Hello, everyone. Thanks for joining us today. I'm Shelley Malott from Cast Crew Marketing. Welcome to another installment of our webinar series, Creating the Digital Production Office. For this webinar, Henehan Company President and CEO, Joe Henehan, and Director of Administrative Services, Lorraine Boatman, will share the details of Cast Crew OpenHealth, an award-winning multiple employer coverage plan designed specifically for non-union entertainment industry employees. You'll learn about pricing, plans and premiums, as well as the measurement periods for crew qualification. We'll also touch on full-time employee counts for the Affordable Care Act and how Cast Crew OpenHealth tracks it optionally for clients of Cast Crew, CAPS, and media services. Before I hand off to our speakers, let me remind you of a few things. If you do have any questions during the presentation, kindly type them into the Q&A box. To help us answer as many of your questions as possible, be sure to upvote if someone has already asked what you want to hear. The team will be answering your questions throughout the webinar. We will also be providing a video recording to all who registered, so be sure to look for that link in your email later today. So without any further delay, let's learn more about Cast Crew OpenHealth. Joe?
All right, Shelley, thank you very much. Glad to be here this afternoon with everyone. Today, we're going to learn about the Cast Crew OpenHealth plan and its ACA-compliant health benefits and tracking for your production crew. OpenHealth is able to serve any vertical from commercials and live events with CAPS, independent features, TV and streaming with media services, or large film and television productions with Cast Crew. So no matter how big and what the size of your production company is, OpenHealth has you covered. Alrighty, so we're going to get the context here of what actually is OpenHealth. It's an award-winning innovative program designed specifically for the entertainment industry. It was a first of its kind Affordable Care Act solution, and we are still unique. We are a fully insured multiple employer welfare arrangement, also known as a MIWA. We designed it with stability and simplicity for portability for the project-based employee, and technically we're payroll company agnostic. Our goal is that you manage production and we'll manage the ACA. So I want to give a little historical context here before we go forward. So this will take just a little bit. In March of 2010, the Patient Protection Affordable Care Act was passed. It became known as the Affordable Care Act, sometimes referred to as Obamacare. In April of 2013, Cast Crew and legal counsel and insurance experts in the industry began to collaborate to figure out a way to help the customers of Cast Crew track their hours and offer a health plan that would keep them compliant. And so we did that, and we were supposed to go live on January 1st, 2014, but the federal government said, nope, nobody's ready. We're going to defer it till January 1 of 2015. So we were queued up, ready to go January 1, but we actually implemented January 1 of 2015. So the law basically says there are two mandates, an employer mandate and an employee mandate. The employee mandate was repealed, so we don't have to worry about that any longer. But the employer mandate is really what we're talking about here. And if you're a certain size employer, known as an applicable large employer, and you have 50 or more full-time equivalents, you have to report what you did, whether you offered coverage or whether you didn't. But if you offered coverage, we then have the solution for that. And the importance of reporting, I can't understate how critical that is, because you're reporting to our friends at the IRS on what you did. So with that, the next topic is, what is the EIEA? And it is the Entertainment Industry Employers Association. It is the sponsor, the plan sponsor of a variety of programs, one of which is OpenHealth. It was designed for employers in the entertainment industry. It provides employer access to human resources training, a 401k plan that's coming out in first quarter of 2021, affinity programs, and the healthcare offering, which is our flagship, OpenHealth. There's a $900 annual membership fee, and that's the fee for 2020. All righty. So one would ask, how do we qualify to join as an employer member of OpenHealth? OpenHealth requires 101 full-time equivalents across all entities. So you're allowing the following types of employees count towards 101 count. So you could have all of your union and non-union project-based employees. You could include your staff, You can include a parent company, a subsidiary, a sister company, and the total count qualifies the employer as eligible to join as a member employer, but the employer is not obligated to offer open health to all of its classifications of employees. So you can get to the 101 by looking deep and wide, although you may only cover 10, 20, 30, 40, or 50 people in the course of a month. So that's the kind of 101 course of how do you get to 101. Are there any questions?
We do have some questions, Joe.
Okay.
Laura would like to know, does the 50 employees include the 1099 on film crews?
Very good question. Technically not. We're looking for W-2 employees. So the answer is no.
Okay. Dana would like to know, this is solely for non-union productions. Did she hear that correctly?
That is correct. It is for the non-union project-based employees, but we can count, although we don't cover them, any union folks or any people in the parent or in the management company. So, but we're covering non-union project-based. That's correct.
Okay, so William is asking, does that mean the minimum is 50 employees?
Very good question. The law requires you to offer coverage if you're called what's an applicable large employer. And that means you take your full-time employees, then you get an equivalent of your part-time employees and call them a full-time equivalent. If that number gets to 50 or above, then you are required to offer coverage or you pay a penalty. You're always required to report. So you're not necessarily offering coverage, but you do have to report. Many employers are benevolent, and also as a recruiting and retention tool to offer the health plan. But it's a 50 full-time equivalent, even though you might only have to insure 20 people.
Okay. And Richie wants to know that 50 employees, is that for any project that they payroll?
You have what we call aggregation. So let's say you have a parent and it has 4 or 5 productions. And if you have between those 4 or 5 productions or 1 or 2, if you get to that 50 plus, then yes, you're going to need to report and you're going to need to offer coverage.
Okay. And Kara wants to know, does the production company have to join EIEA for Open Health?
Yes. The plan sponsor for Open Health is the EIEA, the Entertainment Industry Employees Association. That is the plan sponsor, so that's a requirement. Yes.
Okay. And Nancy would like to know, for how long do the employees need to be employed?
Okay, we're going to get to that one when we talk about the eligibility hours process, so we can defer on that one. We'll cover that in another couple of topics here pretty quick.
Okay. All right. We'll go on to the next section and then we'll answer some more questions shortly.
Great. Okay. So this again is reiterating the 101 FTE. And up here we have in our paragraph here what we call an applicable large employer. And we talk about parents and subsidiaries and brothers and sister groups that we did in the previous. Here's a real live example. There's a production company with 35 full-time staff employees. And obviously with COVID, production's down, but they've maintained their full-time staff. They have project-based non-union full-time equivalents of 40. They might have 100, 200, 300 people touch the payroll, but we aggregate and look at their equivalent hours, they add up to 40 full-time equivalents. And then we have union full-time equivalents. So if you add 35 and 40 and 40, you come up with 115, you qualify. But you only have to cover your non-union employees. You don't have to cover your staff. You're definitely not covering your union folks. So that's an example of how you could get things to count. Okay. And again, we're going to get to that, how many hours you have to work question that was posed a moment ago and another couple of topics here. So what problems are we trying to solve? So as we mentioned, it's an ACA-compliant solution, Affordable Care Act. It's easy to budget. There's no cost allocation. All you have to do is feed us the payroll records each week, and then that's it. You don't have to do any tracking. Our goal here is to make it as easy as possible for you, the user, to work with the program. It meets the minimum value, meaning what's the type of health insurance coverage you're providing, and the affordability requirements. It's portable for employers and employees. It provides large group pricing and benefits. It's paid as a fringe on your invoice. We automate what's called the NOEs, the Notice of Exchanges. That's what you have to give your employees when they first come on board. And we also do all the cobra administration for you. Probably one of the most important things we do is the 1095C and the 1094C. And for those of you that have had to do that on your own and go, oh my goodness, or pulled your hair out, how do we do this? We make it very easy for it because we track all the data through the entire year, and we generate these forms which are required by the IRS. The 1095 goes to the employee, and the 1094C, you have to gather all the 1095s you give to your employees, package them up, and send them to the IRS for tracking. Generally speaking, the IRS is not very friendly. And we have had no problems the last 5 years, 15, 16, 17, 18, and 19. Very few, if any, problems. And if there was one that popped up, we easily resolved it because typically the IRS made a mistake. So we're very, very serious about our tracking and the obligation and the critical responsibility we have there. Okay. So we have a growing number of participants. Currently, we're tracking over 60,000 unique socials, and on the project-based folks, non-union, and it's growing daily. We're very proud to be doing our part to help ensure that all non-union production workers have access to affordable health care. And let me ask, are there any questions at this point before we go on to the next topic?
Yes, we do have a couple of questions. William would like to know, what are the requirements for EIEA membership?
Well, there you go. The requirements are that you need to be an entertainment industry employer. That's a broad spectrum. And there's a one-page application form. And the membership dues are $900 a year for 2020. They're prorated. If you join halfway through the year, we then charge you half a year based upon $75 a month. So the joining the Entertainment Industry Employer Association is really quite simple. You just have to be in the entertainment industry as an employer. Good question.
Okay, and an anonymous attendee would like to know, can you join the EIEA and not participate in OpenHealth?
Absolutely. No problem whatsoever there. You can join the EIEA, not join OpenHealth. You can access the HR services, our affinity programs. Forthcoming will be a 401k plan. So yes, you do not have to have join OpenHealth. You can definitely join the EIEA only.
Okay, and Jake has a question. He says, in the example that gets to 115 employees, can you qualify with 3 months worth of those numbers? Or does the 115 have to be a per month average for 12 months?
Well, that's a really real life situation question. Here is what we have to be able to say. We have to be able to attest to that. If you had the 115 in the first 3 months, great. Okay, I might drop down to 65, but then go back up to 250. So if we can make a good faith representation to the insurance company that we're going to average 101 or more in the course of the year, we're good. But if we know that you're only going to average 35 or 50 in the course of a year, it wouldn't be a good fit for you. And so we're very conscientious of following the rules, but also giving some leeway for good faith, because we know it's never consistently the same population every month. So.
Okay, so I think that mostly answers Kathy's question, but I'm going to pose it just in case there are any nuances here.
Sure.
Kathy wants to know, will there be a program for less than 101 employees?
Okay, there is. So as we do our discovery and there is less than 101 and the parent, sister, et cetera, companies, then there are solutions. And the Henehan Company, the sister company to Henehan Administrators, and Henehan Administrators is the back end servicing entity and organization and staffing for OpenHealth. The Henehan Company helps many employers in the entertainment industry as well as non-entertainment if they have less than 101 employees. So we absolutely have solutions. It would not necessarily be through OpenHealth, but it would be for health insurance carriers and plans in all the states. So in terms of California, New York, New Jersey, Georgia, North Carolina, South Carolina, Florida, New Mexico, New Mexico, Texas, wherever the production company is based, their offices, they might be incorporated in a different state. But if their home office is in New York, we can do it in New York. If they're domiciled in California, so there are definite options. We can find a solution for it, but it takes some discovery. But so far, we've been able to solve everyone's problems.
Okay. Michael wants to know, does a 7-week shoot qualify his production company as having full-time employees?
That's a very good question. I'm gonna pass that one over to Lorraine. Lorraine, go ahead and take that one.
Yeah, it all depends. Again, it's a discovery process. If it's going to be a short shoot, it may not require the employer to offer coverage. We would have to have a separate discussion offline to determine what the future of the production is going to be and how long the people are going to be employed, and then we could go from there.
I'm going to add to that. So, very, very good point. If you only work 7 weeks, then you're technically not required to offer coverage. You have to cover them within 90 days. So we're at 7 weeks. So you wouldn't need to offer coverage, and you wouldn't need to report on those folks. Different story if you wanted to offer coverage. It may not make sense economically to do that if they're going to be gone in 7 weeks. But again, discovery. Good question.
Okay. Carol would like to know, how has COVID production shutdown changed employee minimums?
Well, let me see if I can, the 101 minimums on the open health plan, it's still going to take effect. You got to have 101. However, if you're under 101, then we can do what's called a small group insurance platform down to 2 employees. So there is a solution for you. If you didn't qualify for the 101, or you were at 101 but you've dipped, again, that good faith and that intention, because we know it's not consistent. So if you think you're going to ramp back up, who knows when that will take place? Hopefully soon. And we can make an attestation of good faith, and we're okay. Otherwise, we can help you out with a small group health insurance plan outside of open health. Good question.
Great. We have an anonymous attendee who wants a little clarification on the union versus non-union. He or she asks, so union productions can use this to provide benefits to their non-union crews. Why are the benefits not available to union employees? Is that because their unions provide health plans?
Well, there you go. I'm going to assume this is a great question and this person is knowledgeable. The Cast and Crew plan is solely for non-union production employees, because typically, almost always, the union is offering a union health plan, and typically that meets the requirements of the Affordable Care Act.
Okay, great. We're going to do one more question and then we're going to proceed with the presentation. Nancy wants to know, if she is a California company but doing a show in Italy, does she still qualify?
Buongiorno. That's all I know about Italian. I'm sorry, no comments allowed. If she's doing a show in Italy, she's not required to cover anybody in Italy. It's only those folks based in the United States.
Okay, but she could cover those production employees if they were traveling to Italy to shoot.
Definitely. Yes, excuse me. Definitely, yes. Yeah, thank you for the clarification. Yeah, they could be in California and they're going for the shoot. They're going to be there for X number of weeks or months. They come back to California. They are covered internationally.
Okay, thanks, Joe.
Okay, all righty. So we've covered our 60,000 plus. Very proud of that. And okay, so we're going to go to. So what do member employers think? These are real comments that we've gotten over the last several years. It's fantastic. I call it the not my problem solution. I love it. I don't have anything to do. I don't have anything to do, which is wonderful. We try to keep it easy. Amazing. It's a great program for employers, employees. My employees love it. Brilliant. On the human side, fairly often we will get a phone call coming in, and when they learn that they have the coverage, sometimes there's this sigh of relief. And some folks have actually had tears saying, I'm so grateful that I have coverage through my production company as a non-union project based. I never thought I would have it. So there's some real good anecdotal things in this case. Okay, so let's talk about how does a project-based employee qualify for coverage? And we're going to go through here, and we're going to talk about, I'm a little ahead of myself. Let me go back here. So it's designed specifically for production employees. Employers pay a percentage on taxable gross wages paid to all non-union project-based employees. And the percentages are 3.5% on wages paid to California residents and 5.5% on wages paid to non-California residents. and the contribution is capped on wages of $200,000 per employee per year. So one might ask, why 3.5% on California and 5.5% on non-California? The reason being, California has a robust health maintenance organization, or HMO, healthcare delivery system in California, and the HMOs typically are less expensive in California than a PPO plan. The non-California states mostly have PPO plans and they're more expensive. So that's why the lower rate for California and the higher rate for non-California. The fee is structured similarly to an industry union plan. It's easy to budget, and contributions, contributions appear on a separate fringe. Okay, any questions at this point?
Yes, we have some more questions. An anonymous attendee would like to know, what does portable mean?
Lorraine, I'll let you take that one.
Thank you, Joe. So great question. Portability is a very valuable feature of the Open Health Plan. What this means is that an employee may be working for one or more employer groups and will be able to maintain coverage without interruption as long as the employer groups are members of Open Health. In these instances, an employer's participation in the Open Health Plan becomes very important to the employee, as their coverage can continue without lapse. So it's a very nice feature of the plan. Great question.
Okay. Kimberly would like to know, how many hours do we have to work before we qualify for medical insurance?
Boy, Kimberly, somebody must have queued that question up for us. That's our next
I think that's
quote.
the next slide.
That's our next slide. And we'll cover that in just a minute.
Okay. And Parola would like to know, so if we have a project that is shot in 2 different periods of 90 days in the year, do they still need to offer coverage to those employees?
Good question. The first question would be, do you have the 50 full-time equivalents? If you never hit the 50 full-time equivalents, you don't have to report and you don't have to offer coverage. So I'm guessing, unless there's several hundred, like 3 or 4 or 5 or 600 that are on the payroll for those 90 days twice a year. If you don't have that, so you're in your average less than 50, you don't have to. But that would be a very specific case we would look at with you. Get the data, look at the payroll feeds, do a hypothetical, and say, 1, do you have to offer coverage? And 2, are you at 101 and qualify for Open Health? Or 3, if you don't qualify and you want to offer coverage, either because you're a benevolent employer or because you don't want to pay the penalties, then we can figure out a solution for you in what we call, again, the small group insurance market. Good question.
Okay. Kara would like to know, is the fee only on employees who choose benefits or for the entire payroll?
Very good question. It is on the entire payroll for your non-union project based. And that is what gives us the simplicity of the administration of the plan, because when that employee hits the hours, they're automatically covered. There's no payroll deduction for their portion of the premium for their employee-only coverage. Generally speaking, when you add up the monies you spend on that versus the people that you cover, the ease of administration, all the reporting that we do, all the cobra, all the 1095Cs and 1094 filings, and the ease on your administrative HR staff, generally speaking, in most cases, it's a very good value. But yes, you do have to pay the wages on all employees.
Okay, and Nancy asks, are non-union extras part of that calculation?
That's a nuance. Let's say yes. Depends upon, if you're using a completely outside sourcing company, then typically not. That would be, we could look at that on a specific case and get you a definitive answer on that. But if you're using a casting service, typically, I'm going to say typically not, but we'd have to do a little digger deeping on that.
Okay, an anonymous attendee wants to know, are the costs charged on overtime or just standard time?
All righty, Lorraine, we're going to let you handle that one.
Actually, that's a Cynthia question, so I will defer to Cynthia Tran on our team.
Yes, so if there are overtime hours, they will be taken into account and counted towards eligibility for the employee.
So the hours count towards eligibility, which is good if wanting to cover people, but it also counts on wages, and therefore you'll be paying a percentage of wages on the overtime hours as well.
Yes, that's correct.
Great.
Okay. Jan would like to know, so the employer contribution is based on a percentage of wages, regardless of the plan that the employee chooses?
Very good point. The percentage of wages is to cover what we call the basic benefit that is provided, the basic plan in an HMO in California and a basic PPO plan out of state. So it's to cover the what we would call the lowest benefit plan, which meets the law's requirements. If they wanted to buy a richer plan, then they can buy up, and that money comes right out of their checking account. And we have a slide on that as well, so we'll get to that one as well.
Okay, we'll ask one more question and then we can get on to the slides. An anonymous attendee would like to know, are there any options for union employees that have not yet worked enough hours to qualify for the union plan?
Well, no, you have to be a non-union person to qualify. And when we'll get into the hours requirements for non-union production employees, they'll be eligible, but a union person who hasn't had enough hours yet for the union plan won't qualify unless he's working as a non-union employee for us.
Okay, thanks, Joe.
Okay, all righty. So I'm going to turn it over to Lorraine here, and we're going to talk about project-based employee qualifications. So Lorraine, it's all yours.
All right. Thanks very much, Joe. Appreciate it. So the all-important question, how does a project-based employee qualify for coverage through OpenHealth? To qualify for coverage, an employee must work a minimum of 130 hours in a calendar month during their initial employment period, or IEP. As a side note, the initial employment period begins when an employee enters the plan. This occurs when the employee first begins working for a member employer of OpenHealth or when the employee's current employer becomes a participating member. Once eligibility has been met, coverage will take effect the first of the month following a 2-month waiting period. So for example, if the required hours are met in January, coverage will take effect April 1st. It's important to note that OpenHealth aggregates all hours worked across all member employer entities. So an employee's eligibility isn't dependent upon working for just one member employer. Once an employee has qualified for coverage, a welcome packet with plan information and enrollment instructions will be sent directly to the employee's home address. The information will also be emailed if we have a valid email address on file. Enrollment in the employer-paid medical plan for employee only is automatic unless the employee chooses to make changes. An employee does have the option to buy up to a richer medical plan, add dependents, add additional lines of coverage, or waive the coverage. The welcome packet is sent to the employee roughly 30 days prior to the effective date of coverage, so the employee has ample time to review the information and make enrollment decisions. Again, the employer is not involved in any of the tracking or communication. OpenHealth handles everything. Thank you. OpenHealth has 2 measurement periods and 2 stability periods throughout the year, each period lasting 6 months. Once an employee has qualified for coverage and is enrolled, OpenHealth will continue tracking an employee's hours to determine future coverage. If an employee is working full-time hours through a set measurement period, the employee will qualify for the subsequent stability period. Coverage is guaranteed through a stability period, which means that an employee may leave your employment, but will retain coverage through OpenHealth throughout the stability period. You as the employer are no longer paying wages to this employee and thus no longer paying contributions to OpenHealth, but OpenHealth is paying premium directly to the insurance carrier for this coverage. Another important item to note in the structure of OpenHealth: if an employee buys up to a different medical plan, adds dependents, or adds additional lines of coverage, the employee costs are paid directly by the employee. During the enrollment process, the employee provides OpenHealth with a routing and account number from a designated bank account and authorizes OpenHealth to debit his account directly each month while coverage is active. This is a wonderful feature of the Open Health program as it's a post-tax ACH. So there are no pre-tax deductions from a paycheck. As we all know, pre-tax deductions can be very challenging for the employer due to the sporadic work schedules of project-based employees. Lastly, in addition to tracking hours for eligibility, we are also tracking terminations, reactivations, rehires, etc. When Open Health tracks a consecutive 9-week lapse in payroll activity, an employee's coverage will terminate. When coverage ends, election information will be sent directly to the employee with instructions for continuing coverage through COBRA. This is one area where Open Health exceeds the requirements of the Affordable Care Act. The plan was designed this way to accommodate frequent lapses in payroll, such as hiatus, which is a very common occurrence in a production environment. So essentially, an employee will maintain coverage for roughly 2 months following the termination of employment. This is another valuable and useful feature of the Open Health plan. I'll pause here and see if we have any questions at this point.
We do have some questions. Laura
Okay.
would like to know, when you say non-union employee, are you referring to actors, crew, or both?
Joe, I'm sorry.
I'm
We're just, yeah,
I'm
no,
sorry.
we're
So
referring to any.
For the most part, we're talking about below the line folks. There are cases if someone is getting paid as an actor, but they're not getting union wages, that we can include them. But typically, actors are going to have their own coverage, most likely because they're covered by a union. But we can look at that one specifically as it comes up. Good question.
Okay. Jake wants to know, say I have over 50 full-time employees using the FTE formula. If I make the contributions, but my freelancers don't qualify for coverage, does that meet my obligation to provide insurance?
Very good question.
It does.
Go ahead, Lorraine. Sorry, go ahead.
Yeah, thank you. No, it does, and that's the whole purpose of the contribution on wages. There was an earlier question about whether the production is paying that contribution even for people who don't elect the coverage or waive or don't qualify, and the answer is yes, and that's the reason, because in doing so, the production is meeting their ACA obligation, regardless of whether the employee ever qualifies for coverage or if they choose to waive the coverage. But the employer has satisfied the ACA obligation, and they're good to go.
Okay, great. Mark would like to know, if a non-union employee works for a different production with a different payroll company, does this plan still apply? Great
question. The answer is maybe, and that is because Open Health is agnostic to payroll companies. We do have production companies who are members of Open Health, but who use different payroll companies. So yes, in that case, the answer would be yes. However, if that employee is working for a member employer of Open Health and they're enrolled in Open Health, they go to work for a different production who is not a member of Open Health and is using a different payroll company, then likely this coverage would terminate, and that employee would then qualify for coverage through that ACA solution that production is using.
Okay, great. Nancy would like to know, can employees bank hours?
So that's another great question. We don't use the term bank, even though this looks very much like a union plan. In fact, we do call it a union plan for non-union employees. So we don't use the terminology banking, but it's similar in that we are tracking hours through these measurement periods. And if people are working, if the employees are working the required amount of hours during these measurement periods, then they are qualifying for stability periods. So it's kind of a look-alike as far as banking, but not exact terminology.
Okay. Carol wants to know, how can the New Jersey employee track coverage from employer to employer? When they hit 90 with one employer, how long does their coverage last?
Do you want to take that one, Joe?
I think it's...
Yeah, so let me see if I understand this. So let's say we have an employee in New Jersey And they're going from a production company number 1 to production company number 2. And both those members are members of OpenHealth. Because we receive the payroll records weekly, as Lorraine mentioned earlier, we aggregate it. So they don't have to keep track of it as an employee. If they hit 130 hours in the first month with employer number 1, and then they work there in month 2, and then they in month 3 go to another production company and start hours, they're gonna have their coverage just like they would normally have. So they don't have to track it. We'll track it for them as long as they are working for a member employer of OpenHealth, which is a great thing. We have many folks that go, "Oh, this is great because I can change productions. The shoot's over. I'm going over here." Same thing if it's even within a parent that owns several production companies and the hours aggregate across. So that, in a sense, is kind of like the banking hours in a union plan.
Great. Okay, one more question and then we'll carry on with the presentation. Judy wants to get a little clarification. Once an employee qualifies, they receive benefits for the entire 6-month stability period, whether or not they are still employed?
So what happens is when an employee begins working, as I mentioned earlier, they have to qualify for coverage by working the minimum 130 hours in the defined calendar month. So again, for example, if they meet those hours in January, they're going to be covered effective April 1st. They're going to be in what's called the initial employment period. And the initial employment period begins once we see that person first appear in the payroll system, and then lasts through a full measurement period. So initial employment period can last for up to a year. It all depends on when somebody enters the plan, but a person will not qualify for a stability period until they have worked through a full measurement period, and they have to work full-time hours, which is defined as at least 30 hours per week during that 6-month measurement period to qualify for a stability period. I know I said a mouthful there, but it's a process that every single employee in the system goes through. So everybody's situation is different depending on when they come into the system and where they are as far as the tracking goes. Does that answer the question?
I think
hope
so. Yeah.
Okay.
Okay, so back to the presentation, Joe.
All righty, Lorraine.
Okay, so what you're looking at here is what we call the Employee Welcome Memo. Joe mentioned earlier that the motto of OpenHealth is "You manage production, we manage ACA." All true, but we do ask one minor favor, and that is to add the Employee Welcome Memo to the start paperwork of each new hire. This will let the employee know that you are a member employer of OpenHealth and what the employee can expect regarding future health care coverage. The memo also provides OpenHealth's contact information should the employee have any questions along the way. OpenHealth has a dedicated call center ready to assist, so we do encourage your employees to contact us directly with any and all questions. If your employee should reach out to you with questions, please don't hesitate to send them our way. We are here to help. Now I will turn it back to Joe, who will discuss our carrier partner, Anthem Blue Cross, and the various plans offered through OpenHealth.
Great, thank you, Lorraine. So our carrier partner is Anthem Blue Cross. It has, it's the largest national network of hospitals and physicians in the country. There are more than 900,000 network providers, 90% of all the hospitals and 90% of the physicians nationwide. So we have a very, very extensive network. The next couple of topics we're going to talk about are the health plans in California and in non-California. So up here on the top, you can see California residents. So we offer 3 HMO plans in California. We also offer 2 PPO plans in California, but the basic plan that is covered by the percentage of payroll is this plan here, the Elements Choice. And we have office visits, and we have co-pays, and we have drug co-pays. What's the important part here from the employee's perspective, notice there's no cost here. And the reason is that percentage of payroll is paying for that employee's cost. So they are immediately enrolled once they hit the hours and hit the 2 months. They're automatically covered. When they have a question of whether they want to add dependents, they can do it on the website, they can do it on our enrollment portal, or they can actually type to us as a live person. Okay. Then we have non-California residents, and we offer a PPO plan, 2 of them, to non-California residents. We also offer it to California residents. But notice here, the employee-only cost, again, is 0 because this is covered by the percentage of payroll that the production company contributes. And if they wanted to add a dependent, a spouse, a child, or family, there's the ensuing cost. And again, as Lorraine mentioned earlier, that is going to come out of their checking account, ACH, post-tax. You don't chase any money. Okay. We have a third item here, and this is what we call our bundled program. It includes all of these together. It's an Anthem dental PPO plan, a vision plan, and also a term life and accident and dismemberment plan. And we have 2 levels on the dental, $750 per year or $1,500 per year in benefits. So if the employee only cost is $46 if they pick the basic bundle, and $54 if they pick the higher bundle. Another anecdotal situation, several times a year, which we never love getting these calls because we insure so many people, we get a phone call that someone's passed away. And the term life insurance coverage of the $25,000 is only for the employee, not for dependents or spouses. But when they call and they're confirming if the participant bought this, and we say yes, there's this sort of quiet sigh of relief because they're worried about how are we going to pay for a funeral, memorial service, or final expenses or debts. So it's a very wonderful piece. People rarely think about dying, but with COVID-19, people are much more sensitive to that. So, okay. All right. So I'm going to turn it back over to Lorraine, and she's going to cover a specialty program with Anthem Blue Cross. Lorraine.
Thank you, Joe. So Joe mentioned earlier the 3 HMO plans offered in California in addition to the PPO plans. We like to include this specific flyer in our presentation highlighting the Vivity HMO, as this plan is very popular with our employee population. The plan is exclusive to Anthem Blue Cross and was designed primarily for Tinseltown. There is a dedicated concierge service that members can access with questions and issues. And importantly, Vivity provides access to 7 of the top-rated health systems in Southern California, including Cedars-Sinai, UCLA, Huntington Hospital, and others. Because of its popularity and geographical significance, OpenHealth is very pleased to include Vivity in its plan offerings. I'm going to turn it over now to Cynthia Tran, who will describe some additional and valuable services provided by Anthem Blue Cross through OpenHealth.
Okay, thank you, Lorraine. Okay, let's talk about LiveHealth Online. So LiveHealth Online is a service provided by Anthem Blue Cross that allows you to talk face-to-face with the doctor through their mobile app, which is free to download, or at livehealthonline.com. Once you register and sign in, you'll be able to connect with the doctor within 10 minutes or less. You can use LiveHealth Online for any non-emergency issue. Importantly, if anyone experiencing COVID-19 related symptoms, it is recommended that they use the service. This featured program has also proved to be very popular now, as we know, as everyone is trying to access online care at home. We have also found that it's a great resource for employees and their families if they have not yet qualified for coverage and are still in a waiting period. I also want to point out that anyone can use the service regardless if they are enrolled in a healthcare plan or not. For individuals not enrolled in a healthcare plan, the cost for an online visit is just $59. Employees enrolled in OpenHealth will pay either $20 for a visit if enrolled in a PPO plan or $10 a visit if enrolled in an HMO plan. Either way, you'll always see what you owe before you begin a visit. Okay. Another great tool from Anthem is the Resource Advisor and Employee Assistance Program. So this program offers 24/7 confidential referral services that can help connect you with an advisor on a number of issues. For example, an advisor can assist you and your family with arranging up to 3 visits with a counselor. The advisors can also put you in touch with a financial consultant or lawyer should you need it. Employees participating in the OpenHealth plan, along with members of their household, can access this resource by going to the link reflected on the screen. Before I hand it back to Joe, wanted to check in with you, Shelley, if there are any questions.
We do actually have a lot of questions. Can
Okay.
LiveHealth doctors prescribe medications?
Great question. So the cost of LiveHealth Online does not cover the cost of prescriptions, but doctors can prescribe any necessary medications that can be sent directly to the preferred pharmacist. So I actually just used this service last week to get a refill on some allergy medications, and I was able to pick it up from my CVS in less than an hour. So it's a really great resource.
Okay. How long has OpenHealth been offered?
I could take that one, Cynthia, if you'd like. It started January 1st of 2015. So 15, 16, 17, 18, 19, we're in our 6th year. And we began working on it in April of 2013, and it went live January 1 of 15.
Okay, great. Jan wants to know, can an employer opt to cover a higher priced plan than the HMO the plan currently offers?
Lorraine, do you want to take that one?
Sure. So as we discussed earlier, there are options for richer plans, and when an employee chooses that option, as we mentioned, they would provide their routing and account number to their bank account information, and then we, OpenHealth, would debit their account each month for that employee portion of premium. Some employers do opt to reimburse their employees for that portion. Many do that, so that is an option. So you would just be making the contribution on wages, and then if you chose, you could reimburse the employee for their portion that's coming out of their bank account. If you do something like that, what we do advise is that the employer do that across the board for a certain class of employees, so that it's consistent and there's no discrimination issues. But yes, that's something that the employer could do.
Okay. An anonymous attendee would like to know, by offering a $0 employee-only option, does that mean we would automatically meet the ACA's affordability requirement?
Lorraine, I can take that one.
Sure.
The answer is yes. That's a very straightforward, simple question. So they're fully compliant.
Great. Another anonymous attendee wants to know, what is the origin of the 2-month waiting period? Will that ever change so employees can be eligible sooner?
Lorraine, do you want to take that one, or would you like me to take that one?
You can take it. It's ACA, but we do have. But go ahead, Joe.
The way we designed the plan was you hit the 130, and then 2 months later you're covered, because the law requires that when a person's full-time, they be covered within 90 days. And so since we can't technically add somebody's coverage effective date mid-month, we do the 1 month, 2 months lapse, 2 months follow, then you're covered. The law currently, in terms of the ACA, OpenHealth has got its formula for ease of administration. But if you were not part of OpenHealth, let's say, and you were with a different employer plan or a large corporate plan, you can cover somebody sooner than 90 days. You can cover them in 60 days. You can cover them in 30 days. But our plan currently is that 130 hours, 2 months later, you're covered.
Great. Judy would like to know, is the plan fee percentage based on salary only, or does it include mileage and box rental?
Joe, I can take that one.
Yeah, take that one, Cynthia. Thank you.
Okay, so the percentage is going to be based on taxable wages, and it does not include mileage or box rental.
Okay, Jan wants to know, if we use Cast and Crew payroll, could the reimbursement be automatically put on Crew's payroll?
Yes, working with the payroll service, you can reimburse on the payroll through Cast Crew Caps or media services.
Okay, and we have 2 questions around Cobra. One anonymous attendee would like to know, how long can someone stay on Cobra? And William would like to know, what are the Cobra costs?
Okay, great question. So as the OpenHealth plan is domiciled in California, COBRA continuation coverage is offered for a total of 36 months or 3 years. So there are 18 months of federal COBRA and 18 months of California COBRA. So it's a generous period of time. It's also important to note that employees have the ability to maintain coverage even if they're no longer working for a specific production. So what that means is we have many employees who transition from active coverage to COBRA coverage and then back to active when they return to work for the same or a new production. So it's an opportunity to keep coverage in place even if they're not working in a seamless type of environment and there's no lapse in coverage. So we have many employees who do that. So again, just a very nice feature of the OpenHealth plan. As far as costs, it's just the basic cost. It depends on the plan that they're enrolled in, but it would be the raw rate that is charged by the carrier. And when we send the COBRA election paperwork directly to the employee, all of those costs are outlined in that election paperwork.
Okay, great. We only have about 8 minutes left, Joe, so I'll let you get back to the presentation.
Alrighty, thank you. So it's easy to sign up. The first step would be, if someone wanted to join OpenHealth, is you join the Entertainment Industry Employers Association, the EIEA. That's a one-page application. It's very straightforward. Then you would execute a participation agreement with OpenHealth, and then you let Cast Crew and OpenHealth do everything else. So again, our goal is to manage ACA and you manage production. To make sure we're wrapping right close to on time, this last piece of information is our website, questions at cc.openhealth.com for email, and our toll-free number. So any one of those ways, you can reach out to your sales reps at CAPS or Cast Crew or Media Services. They'll work with Cynthia getting the data put together, and then we can do a conference call or communicate back and forth via email to answer any and all of your questions. So with that, thank you very much.
Okay, well, we have time for a couple more questions then, Joe. Kara would like to know regarding COBRA, when an employee returns, is there a waiting period before they can go back on the plan, or is it immediate?
Good question. We'll let Lorraine handle that one. This is a common occurrence. Lorraine, go right ahead.
Yeah, very, very common occurrence. So there's basically two situations. There would be a reactivation or there would be a rehire situation. So if an employee has gone on to COBRA and they return to work, either for the same production or a different production who's also a member of OpenHealth, and it's within a 22-week period, then their coverage is going to be reactivated the first of the month following the first payroll date that we see in the data. So then they would just transition seamlessly from COBRA onto active coverage again, and they would just contact us and we would help them facilitate that. Again, this is something that happens very frequently. If they return to work after 22 weeks, then they would be considered a new hire, and then they would have to qualify again by working the 130 hours in the calendar month. They would have the 2-month waiting period, but during that time they could remain on COBRA, and then once they qualify for coverage again, they'll receive that welcome packet that I talked about earlier. They would stop paying the COBRA premium, and then they would start on active coverage as of the effective date that their coverage begins. So again, this is something that happens frequently. If they have any questions, we encourage them to reach out to us, and we would just facilitate that, that transition for them very easily.
Great. So Kara is looking for a little clarification. She wants to make sure that the total cost to employers are $900 per year EIEA fee and 3.5% of total payroll for California employees, 5.5% for non-California employees. Is that correct?
That is correct. Very simple. Yes.
Okay, great. An anonymous attendee would like to know how he should know if this is a good fit for his company.
Joe?
I can take that one. Our approach is doing discovery, learning about all the various entities and production companies, and designing, looking at and say, is OpenHealth a good fit? Generally speaking, it's pretty straightforward when it's a good fit. If you have less than 101, then it won't be a fit because you have to have 101. And in that environment, again, we can design what we call small group versus large group plan to help you. And we will do the numbers and the arithmetic with you, show you the analysis, and it usually is a pretty easy decision to say this is great, or it just doesn't quite fit our cup. It's not our cup of tea, and it's okay. We're here to give you advice and figure out what's the best fit for you.
Great. Another anonymous attendee would like to know, we have non-union loanouts. How does it work with that?
Lorraine, you want to take that one?
Yeah, and actually I'm going to defer to Cynthia because this is something that she handles daily.
Yeah. So loanouts are included in the plan, but productions do have the ability to opt loanouts out during sign-up. But they are eligible for benefits under the project-based plan.
Okay, great. Looking for a couple people wanted to get a copy of some of the documents that you had in this presentation, Joe. Are
Yes.
we able to share those files with attendees?
The files in our presentation, they will be part of the download, yes. If you go, are you talking about the benefit summaries and the costs and the like?
Yes, we've had a couple people ask if they can get that information.
Yes, that'll be, as you are downloading the webinar, it'll be in those pages. We can also, if we want to get their information, we can email them the summaries as well, yes.
Okay. And then we did have one more person ask, who do I contact to join? That information is on the slide here, but if you want to reiterate the process,
Sure.
Joe.
So you can email questions at cc-openhealth.com, or you can call us at 866-491-4001, and then we will get you the documents.
Yeah, and I would add, probably the most efficient way is to email us directly at questions@cc-openhealth.com. Cynthia and I, Lorraine, man that email address. So if you just reach out and let us know that you are on this webinar and you have questions, we will respond very quickly.
All right, I think we have time for one more question regarding loanouts since we were on the topic. Kara would like to know, if you opt loanouts out of coverage, is there a payroll included in the 3.5% fee?
Cynthia?
That is a good question. Yeah, so if a production chooses to opt their loanouts out, the wages for the loanouts are not included, and the fringe is not applied on their wages.
All right, thank you everyone. That is the end of our webinar, and thanks to Joe, Lorraine, and Cynthia for that very informative look at Cast & Crew OpenHealth. If you have further questions regarding Cast & Crew products and services, we welcome you to contact us directly by emailing salesinfo@castandcrew.com. We look forward to seeing you at future webinars, and until then, stay safe. Thank you, everyone.